Hello and welcome. I am Dr. Lara May, a clinical pharmacist specializing in functional medicine, as well as a certified yoga teacher and Reiki master. I run a truly integrative health coaching practice encompassing functional medicine lab testing, yoga and meditation, and a sprinkling of Reiki energy medicine. Join me here on Light Body Radio to break through your health plateau and come into alignment with your natural vitality. Hello and welcome to Light Body Radio. I'm your host, Dr. Lara May, and today we have with us Camille Zenobia. She is a microbiologist and an oral health advocate and activist. So I'm super excited to have her here. And I'm just going to let her get started with telling you her story because I'm super excited to hear it. And I think this is going to be a really interesting episode to really discuss the ins and outs of oral health and why we need to probably be paying much more attention to it than we actually do. So welcome.
Thank you. I've had a really wild journey to end up as this kind of oral health activist. I gave myself that name on Instagram when I was working, I guess I was working in research, but I had pivoted from academia to industry. And I was really kind of becoming eye-open around some of the nuance. And so I just really wanted to be able to share some of that with a broader audience. And that's kind of how I started getting on my podium, if you will. But if I were to start from zero, I would say first I was a hairdresser, really trying to find my way in the world and knowing that I was a social creature and really wanted to, talk to people all day, and also contribute something meaningful into their lives. And so I was a hairdresser for, quite some time, 17 years. And while I was doing that, I put myself through school and I ended up doing chemistry undergrad and a graduate degree in microbiology. And what got me interested in going into the microbiology space was this host pathogen interaction where some people get sick and others don't, and why. There's nuance there. And, I could talk about that all day. But when I chose my graduate lab to work in, I ended up in the oral cavity because there's this immune landscape that's largely undescribed, and we're still learning real time about it. So some of the work that I've been privy to is looking at how the oral health aspect and the inflammation in your gingival tissues can drive dysbiosis in your mouth that then travels to your gut and can end up causing metabolic endotoxemia, diabetes, potentially Alzheimer's, exacerbating arthritis. There's just a whole lot of downstream, and of course, cardiovascular disease. So all of it really connected, and there does seem to be a feedback loop. And so I've just gotten really into this kind of holistic, I call it moving through the donut hole, where all of the gut research is predicated on things going into your mouth. And so they've kind of lopped off the mouth aspect and have focused solely on the gut. And yet there's this upstream area that is so important.
Yeah.
The other
is, sorry, keep going. Yeah.
Jump in anytime.
I was just going to say that it's so true that even like when we talk about nutrition, we very rarely talk about the chewing aspect and all of the things enzymatically and microbially that happen in your mouth that start digestion before you even swallow. And that's why even just the act of chewing is so important, because you have that first enzymatic breakdown of whatever you've chosen to eat. And if you don't do that well, then even when you get into the stomach, your stomach is having to work a little harder. But even, again, and like you said, there's so much downstream. and the pH balance of the stomach, and if that's not balanced enough, then again, like your food's at another step not getting digested and absorbed, blah blah blah. So anyway, keep going. I just
Yes, yes. Yeah, all of that, yes. And also there's that oral tolerance. And we think that a lot of it is happening in the gut, but there's a first exposure in the mouth that really sets up the stage for that process. And that linkage is just starting to be unearthed. So, we're at a frontier, as I see it, in the oral cavity, where we are just kind of scraping the surface and really understanding what is happening. So, concordantly with the products that we use in our mouths, those were devised in the 1950s when we had this very strict pathogen way of dealing with microbes. So we thought that we had to do a full clearance. And so when the products were made for our mouths, it was really a detergent, antimicrobial approach. And
Mhm.
now we're starting to see that we might have really done a number on ourselves. So we first saw stories of this with the nitric oxides issue. I don't know if you've been following this research, but
No, what is this? Give us a little bit of
so
background for the listener.
nitric oxide is a really important function that helps your vasodilation. So if you think about heart health, you want your arteries to be open and clear and functioning properly. And we
Mhm.
have this microbial driven nitric oxide production that helps our heart health vasodilate appropriately.
Okay.
And there are a couple different ways to create nitric oxide in our bodies, but a lot of it comes from our mouths and the
Mm.
microbial biofilms that are structured mostly in our tongue. And so it's been found that therapeutic chlorhexidine that is
Mhm.
often used for periodontal disease uh, can actually disrupt and remove those microbial species that are
Mm.
responsible for nitric oxide production. And what happens then is you see a, a bump in blood pressure because your vasculature isn't dilating appropriately, and we're
Yeah.
putting these people at risk. And so there's
Oh,
been
yeah.
some data to suggest that you have an increase in mortality when you're utilizing this product in the hospital setting.
Right, I was just thinking that because we use it actually fairly frequently in the hospital, for
Yes.
patients prior to surgery. Some patients throughout their hospital stay will have them, swish and spit almost daily with this stuff. And if you
Yes.
think about too, like, patients are already stressed out when they're in the hospital, and I'm just thinking about this patient we had this last week. We could not get his blood pressure under control. I mean, he was on multiple IV drips. So IV drugs that we titrate at, very specific weight-based rates to get his blood pressure under control for various mechanisms, routes about going about this, and he was awake with it, like not intubated really, other than his blood pressure, not that sick, so to speak. I'm using air quotes, but relative to how we think about hospitalized patients, especially in the
Right.
ICU. But yeah, so that's just so interesting, and so there's this whole discussion about, like, well, are we missing something with the medication? And so there were a few, being the pharmacist on the team, there were a
Yeah.
few routes and mechanisms that I was able to suggest, or like dosing, recommendations that we hadn't actually maxed out yet. I'm like, well, we could go up here, we could go up there, you know.
Yeah.
But that's just so interesting. So at one point I went in and I even had sort of like a stress management and breath work talk with him, and which is
Wow.
very unusual for the hospital setting, but we were literally at our wits end with this guy. We're like, okay, like, this all seemed psychosomatic because there was no other indication for him to have such a high uncontrolled blood pressure.
Wow.
And there was like, like, he was ready to go home. He wanted to get out of the hospital, but it was so unsafe and we couldn't get him off of the IV drugs with, and get him stable on orals. So there's like a huge barrier to discharge. And so like we literally, and at that point, because I don't often bring my, all my alternative tools into the ICU when I'm there with, my rounding team and my physicians. But sometimes when you've, exhausted all your resources and you have a case like this, I think it's appropriate. So I'm like, well, I do this in my private practice. Are you open to me having this discussion, like getting permission if the patient's open to it? And at that point, they were like, yeah, sure, please. Like, we'll
Yeah,
try
right.
anything.
Just get me out of here. Yeah. Did that help? Yeah.
So it did. It did. It's still, I think because patients too, there has to be a buy-in and absorbing of the information that they're given, and sort of this understanding about their own physiology and their own role and what's unfolding. So it took another like a day or two of processing and practicing, and I think, but yeah, we saw eventually a downtrend and we were able to discharge him. But yeah, it was very interesting.
Wow. And you guys were treating him with chlorhexidine daily, I
Um,
imagine?
this guy he was actually not daily, but it just made me think about how much we use it. And
Yeah.
he had that's something that we actually do pretty regularly for patients when they're admitted, is they get this, it's like a standing order
Yeah.
for chlorhexidine rinse. And if you're going for surgery, then you get the chlorhexidine bath, which is essentially just like a swab, a full body swab.
Yeah.
And you're right, it's a detergent. So for surgery, when you're going to cut, there's a lot of opportunistic bugs that live on our skin that you want to prevent getting
Yes.
in. And, but it's so
Yes.
interesting thinking about the oral cavity, and you're right, that nitric oxide production and the benefit that it has. So that's, again, for those of you out there that are unaware, nitric oxide or drugs that potentiate nitric oxide are part of what we use for treating hypertension too, for high blood
Right.
pressure.
Like
It's not
arginine.
first, yeah, it's not first line, but it is something that we use, and it's been in use and practice for many, many years. So
Right. I
so
mean,
interesting.
why otherwise would you eat the green vegetables, right?
What, you mean green vegetables have nitric oxide and can help us and we don't need a medication? What are you talking about?
And you get to poop too. That's so exciting.
Oh, amazing.
It's essential functions.
It is.
Um,
Yeah.
so yeah, I'm so glad that you highlighted all of those features of being in the hospital, because that is a huge piece. And I don't mean to minimize the importance of using something like chlorhexidine as a skin prep, because it is very potent and keeps those microbes down while you're trying to do some therapeutic interventions. Very important. But I do think we have to be mindful, especially in the oral cavity, about daily use and how long that might go on for, and how we might counteract
Mhm.
potentially, trying to, I don't know, balance out that problem that we could be potentiating. I do also think that during intubation, it's a useful tool. We have great data to suggest that it can minimize lung infections if you use the chlorhexidine on
Mhm.
the device before you do the intubation. But
Oh,
um,
on the device.
yes,
Not so, yeah, so a lot of times what you'll see is like this, you will use the swabs in the oral cavity itself, but I don't
yes,
know if it's on I'll have to ask and pay more attention. I know, like, for emergent intubations, it is, it's emergent, so you're not,
right.
swabbing.
No time for that.
Yeah. So I think, honestly, like, chlorhexidine is oftentimes an afterthought, but it's one of those things where like, oh, we need to do this. It is for prevention. And so that's so interesting. Okay, keep going.
Yeah, yeah. Well, so the other side of the product story is just your daily take home. Because most of these products, I'm never going to demonize fluoride. I'm not that kind of person. I think that, there's few tools in dentistry, and we know that fluoride works. And of course, the dose equals the toxin. So always keep that in mind, meaning that, as long as your dose is low, it's not going to be a systemic issue. I will say this. There are endemic areas of fluoride in the water, in the soil, that is not added. So like all of India has an endemic fluoride situation, so that their toothpaste is actually more high has higher regulations, so you can't go over 1,000 ppm in their India's toothpaste, whereas you can go to 1,100 here, and it's because of that background exposure. So that's just one thing to keep in mind. There was a really lovely paper that came out in diabetics population showing that there was this subpopulation that had fluorosis. Now, this is a high cavities risk group, and they already had fluorosis. They're still getting cavities, but yet we don't have any additional tools necessarily. So I wouldn't want them on more fluoride, but yet it's like reflexively what we do in dentistry, because it's really the only tool that's in market that's been validated. So this is, an open area of research. And it's tricky because getting a new drug application for something that's going to be $4 to $10 in market is a hard call to action.
That's interesting when we think about the cost of prescription medications.
Yeah,
$4 to $10 doesn't seem so bad.
Well, on our end, on the consumer end, sure.
Right. Well, that is true. Yeah.
Development end.
No, yeah, it's totally true. Like when we're looking at, like healthier deodorants, and or toothpaste,
yes,
it's funny where our mind goes, and it's like we start weighing that cost aspect, but we're more than willing to throw money at something that's not good for us, whether that's food. Again, aluminized, is that a word? Aluminized deodorant.
Right, I got you.
Deodorant with aluminum in it. And again, like, mouthwashes that are very harsh. I'm thinking of one specifically that's known for its antibacterial effects. And then
I'll call it out. Are you talking about Listerine?
I am talking about Listerine. Yeah.
So there's a twofold punch there. So their active is really a very potent essential oil package, essentially, and that's what gives it that very unique flavor. But also their alcohol. So they have those two pieces in there, and the alcohol is really to help the essential oils get into the water-based background.
Into solution.
Right, exactly. But the alcohol has been shown to potentially elevate the risk of oral cancer. And then the essential oil profile is now kind of on the hook for disrupting the oral microbiome. So there are a couple things that are happening there. I know that they're struggling right now with the perception in the oral systemic health practitioners, because there is concern. And there has been a number of studies in mouthwashes specifically. Again, it was in South America, looking at a pre-diabetic population. And they basically showed that in the pre-diabetic population, those that were doing a daily mouthwash, now they didn't specify which one, just any daily mouthwash, were at a higher risk for transitioning from pre-diabetic to diabetic.
So can I interrupt with a follow-up?
Yes.
In terms, because you've already, another study you mentioned was also a diabetic population.
Yes.
So can we talk about sugar in the oral microbiome and how that affects it? Because I'm sure it does. But can I ask you that? Can we just start there? Does it?
Well, so yes, of course. So the sugar is basically a catalyst for acid production by our oral microbiome, and that is typically associated with cavities, right? So that's why the diabetic population is at higher risk, is because they can't control the sugar aspect in their bodies, which leaves them at higher risk for creating acid in their gum tissue and erosion. Yes.
So I know you guys out there with diabetes are, like not stressed out enough about your blood sugar. But
yeah, right.
Just help you.
Just another thing to track.
Just another thing to worry about. No, I'm just kidding. I also work very closely with a lot of diabetic patients, and I help educate and reverse type 2 diabetes. So that's why I asked, because I'm always in excited to bring more light to ways that we actually do have control. So that's the way I see it, is like, this is just another way where we actually have control over something that we can fix. It's, so is there anything else we want to, because I know there's so much here,
There
in
is so
terms,
much.
yeah, that we want to talk about in terms of like sort of injury or like contributing to inflammation before we talk about solutions, because I do like to leave my listeners with solutions, because
Yes, of course.
there's
Well,
always
okay.
solutions. So yeah, but we can talk
So,
about more like insults to the injury if there's something else that's really standing out that you want to bring forward.
well, I think that driving home the idea that in your gingival tissue, if there is localized inflammation, if it's left uncontrolled and not tended to, and let me remind everybody that usually our oral health does not cause us too much pain. And when there's pain, the issue has grown to a degree that is awful. And
Mm-hmm.
so the gingival tissue, if there's inflammation, we have to kind of understand where it's coming from. So if it's localized and we take care of it, not a big deal, who cares? If we have this ongoing chronic inflammation, like you're seeing blood when you brush your teeth or whatever, that is going to, if you're not taking care of it and you're not stopping that inflammation train, it will create oral dysbiosis, which means your microbiota is going to transition from a good disposition to not good. And what that looks like is a bacterial profile that actually feeds on inflammation and becomes bolstered by that environment and like feeds forward that situation. Those specific bacteria can also go to the gut, cause IBS, and metabolic endotoxemia, and then you get that whole feedback loop. Leaves you at risk for cardiovascular disease. So when you're having those inflammation moments in your gingival tissue is also wide open. It doesn't have the tight junctions that are in your gut. So all of this now is very wide open, and it's now everywhere. So how do we get to a solution?
Mm-hmm.
You definitely want to be mindful of where you are with your systemic health. So if you are perfectly healthy in the oral cavity and you start to have a risk, pre-diabetic, cardiovascular issues, any of that, it will eventually catch up to your mouth. Or vice versa, if you start with a localized infection in your mouth, it can feed forward and affect your diabetic background, your cardiovascular, your arthritis. So all of it is related, but you definitely want to be mindful of both sides of that story. Assuming we're only in the oral cavity, this is where I like to talk about the products in market that are $4 and easy to get and
Mm-hmm.
very minty are basically detergent antimicrobials. And one of the issues that has come up in skincare is that there's an increase of allergy and sensitivity that has been kind of like increasing over the last 50 years or so. And so skincare has gone through a whole reformulation where they've minimized fragrances, they've minimized detergents because they know that's too stripping. And so if we think about our faces and we understand we can be more or less sensitive, I might be able to use a bar soap and you may not. It really is person dependent. So I'm not going to throw away all of the $4 toothpaste. I am going to say, if you have an ongoing issue in your mouth and you're using all the things that you were told to use and it's not working, I would urge you to try something new.
Mm-hmm.
So there are more gentle options. There are like Boca does an HA, which is a hydroxyapatite, which has shown some benefit for cavities. There's not a lot of like fun actives out there that are specifically tailored to the gingival tissues and minimizing inflammation. I've been investigating niacinamide, which is well known in the skincare space. I've been looking at it because it does a fantastic job of minimizing specific inflammation that is seen in the mouth. And so I created my line of products. But generally, I would just urge you to explore the gentle alternative toothpaste, because they're going to be a lot more mindful of the background formulation, trying to minimize inflammatory products. And so if you're worried about fluoride, I would go get the fluoride varnish. It's a one and done, covers you for 3 to 4 months, so that you're not without fluoride if that's important to you. And then really get exploratory with your oral care to find something that works and minimizes that inflammation, because sometimes it's just the product itself. That $4 product has a lot of detergents that could just be irritating in itself.
What about, I have lots of questions. So my first question is, what about xylitol? Is that helpful, or is that contributing to the problem?
There is some evidence to suggest that I would say that it doesn't look harmful.
Okay.
It looks like it might even promote some of the good bacteria.
Okay.
I don't think our studies are big enough, but there are trends. Yeah.
Okay. Oh, that's good to know.
The only thing about xylitol is that it's unsafe for dogs.
So be careful. Don't let your dogs eat your toothpaste.
Exactly.
Okay, cool. But I would say the xylitol, I've seen the xylitol in both a mouthwash product, a toothpaste product, and even chewing gum.
Yeah.
And it's advertised as sort of like protective or like anti-cavity. So
yeah, okay. I don't think we have a good read on anti-cavities, but there is, again, the trend for the better bacteria.
Okay.
And
it's obviously not as harsh. So at least you have that going for it. So my next question is, in the tradition of Ayurveda, they talk about digestion starting with the mouth, and so many other health aspects starting in your mouth. And their approach is oil pulling, tongue scraping, and then the lemon water first thing in the morning on an empty stomach. Those are sort of like the classic 3 things that I feel like if you're going to work with an Ayurvedic practitioner, they're going to suggest, if not insist, that you start doing and making your daily habit. And I've done it, like, I know this personally because I've worked with an Ayurvedic practitioner, and this is actually something that I continue to do. I will say the lemon water I'm inconsistent with these days, but oil pulling and tongue scraping, I am still actually very diligent about. So what do you think about those 2 things?
The oil pulling is deeply fascinating. Again, the research is kind of all over the map, and there's a few reasons for that. One, dental research is not always that high quality. Also, when you're getting into the supplement category, you have a lot of underpowered studies, we'll say. So I couldn't really give you a good feel but I'm going to say that 100% better than using a mouthwash. Definitely. I mean, I know I've heard people say I don't have any more headaches. I actually feel better. I don't care if it's a placebo effect. It's not going to do you any harm. Yeah, go ahead and do that. And I know that there are oral care products that are kind of based on that oil pulling with coconut-based products. I don't think that's bad. Again, those are going to be more gentle, just holistically. So yay.
Okay. And just for all of you out there, like, the premise behind oil pulling is that you're using your own saliva, which we know is active with enzymes and has it's your own. So should be contributing to your oral health. If it's like within the right balance. And then you have the oil aspect. And to be specific, within the Ayurvedic tradition, their oils are very specific. So whether it's, a sesame or coconut or, almond or whatever it is. So from that perspective, I'm sure there's something specific there that is woven into that ancient tradition of medicine that is helpful, that we probably don't understand completely. But if you're just out there and you want to start trying it, coconut oil is known to have, antibacterial properties in the caprylic acid, correct?
Yes, absolutely.
Yes. So then there's that aspect too. And then so like you're using the oil, it's a lubricant. It's not, it's sort of like you are using facial cosmetic approaches as an example too. If any of you out there have heard of the oil cleansing method for your face. So
Yes.
we know that oil dissolves dirt and it's very gentle, it's hydrating. It does have some antimicrobial properties to it. So the concept with that is you get your face nice and hot with a, hot steamy washcloth. You put the oil on, you rub it around, and then you wash that off and the dirt comes with it. And I
Yes.
will say, like, I used to have really bad cyclical acne. And since I started doing that and then changing my diet, it's a very much two-pronged approach. But the first step was just using that, and it helped a lot. It really calmed down my angry, very confused skin. And then after changing my diet, like working from the inside out, huge shifts and benefits. So stands to reason that our mouth also has similar but different membranes and tissue layers. And so the oil, in theory, could be just as beneficial for those tissue layers as they are for our superficial skin. So something to
There's
think
also
about. Yeah.
you bring up the fatty acid profile of coconut, and so there's more than just the caprylic in there, and many of those fatty acids have been evaluated against certain oral pathogens to show a benefit. So I think that's an important piece to that story that you're speaking of. Again, there aren't a lot of clinical trials that it's so expensive to, do a full microbiome analysis of a whole lot of people. So you get these little taste and tidbits and trends, and it makes you feel a little warm and fuzzy. But again, like, I don't think it's going to harm you. I think it will only provide a benefit, and you're certainly kind of moving away from the harsher options. And I think that's always a good plan.
Right. Yeah. If you're still a Listerine user out there and you're now
Right. Well, I mean,
confused about like, oh my
I
God,
know.
what am I doing to myself? This might be a nice,
Well,
gentle alternative.
exactly. Well, and then like most toothpastes on the market have SLS. And if you understand, sodium lauryl sulfate gives you that sudsy feel. That is generally, if you're going to have an irritation, you're going to have an irritation to SLS, but also stannous fluoride, which is often given or promoted for gingivitis. So any gingival inflammation. And some people tolerate that very well, and it's very effective. But other people can get mouth ulcers, and there has been documentation. So stannous is a form of tin, and tin is basically cytotoxic, and I could get into the mechanism of how it acts in inflammation. But there are some people who have tin allergy, and they almost never test for that. So there was a case study that was written up about a woman who had this crazy gingival inflammation. She was put on stannous fluoride. She got worse 2 years before they ran that allergy assay, showing that she was tin sensitive.
Yeah.
Nobody
Crazy.
should have to wait that long.
No. And just FYI, everybody out there, that's one of the first things, if you work with a functional medicine practitioner, they should be doing is testing you for sensitivities and allergies.
Yes.
Just a little tidbit. Okay. So, so then my next question was the tongue scraping. Where do you feel like
I love the tongue scraping, especially after a nighttime of sleep, because you basically, hopefully your mouth closed, right? And
yes,
yes,
yeah.
You should be mouth closed while you're sleeping. But that is basically creating an oxygen-free environment, which can allow the oral pathogens to kind of proliferate. So you always wake up with a slight imbalance. This is normal. And this is one of the reasons we brush our teeth in the morning. And I definitely would promote the scraping at this time. But now that we understand the nitric oxide story, I would like to see a little bit more evaluation on tongue scraping specifically because I know those microbial communities are important. So I'm a little bit on the fence, not that I've stopped because I really do also enjoy clean breath. So,
Mhm.
but I think that instead of doing it twice a day like I was, I'm just doing it once a day and kind of hoping that I strike a balance.
Yeah, so I think the alternative to tongue scraping is people that brush their tongue while they're
Yes.
brushing their teeth.
Yes.
And my Ayurvedic doctor practitioner was like, "Stop doing that because you're just rubbing all that gunk that's on your tongue into the tongue." And it's getting so her argument was that like you're like smashing it in there and it's getting reabsorbed.
Well, okay, so
So that
if
also
if
sounds
you
gross.
if you look at toothbrushes today, typically the ones that are made by kind of giant conglomerate oral care manufacturers like Crest and Colgate, they actually have a backside on their toothbrush that is specifically a tongue scraper. So it wouldn't be using the brush part that you've just tracked all over your filthy teeth.
Yeah,
But
yeah.
now you have a specific tongue tool. Again, I just use a beautiful spoon because I think that looks great in my bathroom
Mhm.
and gives me this. I feel like more effective removal than the little tiny scrapey thing on the backside of the toothbrush.
Yes, yes. And then from the Ayurvedic perspective, they recommend the metal. It looks like a big U shaped,
Yes.
and you use that. So scraping from back to front. And they say
Yes.
7 to 10 times. 7, you get all 7 chakras, and then 10 just for all the bonuses and all that good stuff. So, okay, I'm sure there's a reason for the 10. I just don't know what it is, but I do know 7 is for all your 7 chakras. So,
Interesting. That's very
yeah.
sweet. I like that.
Okay, anything else that you recommend that we can do for ourselves to help?
um, just know that the traditional dentist and medical care provider aren't always in the know on the latest research, and
Mhm.
to be forgiving when they
Yes.
are pushing products that might not work for you, because they're just trying to look out for you in the best way that they can. I think that's an
Mhm.
important message.
Yes. No, that's so true, and I mean, that's a true message with, I think, all of Western medicine trained practitioners, because I get that question a lot. Well, why don't our, practitioners know these things? There's not how they're trained. So, in order to know these things after we're done with our graduate work and all that education and schooling and residencies and fellowships and all that stuff is to go find it out ourselves and to
Yeah.
do, to examine all that primary literature and research and decide for ourselves as practitioners how we want to move forward. So that's why. So,
Yeah.
so I love that. Be forgiving, be gentle, but
Yes.
also, I would say like be your own involved advocate.
Yes,
It's
please.
always a big
Yes.
message I have for my clients, for my listeners. Like your healthcare should not be sort of like this dictatorship where you have someone
Yes.
dictating to you what you're doing.
Right.
You should be the one deciding, actively involved, asking questions, maybe having, a leader or a guide for, knowing that we can't all know everything. So we need people that
Right.
know more than us to help us, but
Right.
or that are experts in some things to help us.
Yes.
But don't just be a passive participant, be an active advocate.
Yes, one of the things that I will kind of contribute here is the dental visit. I hope that everybody is getting their probing measurements, so they go in and evaluate tooth by tooth what your gum tissue recession looks like. You really
Mm,
want zeros and ones, nothing more than that. If you have more than that, you have some issues. Um, and of course, with age, you typically trend to, lose some, but it should be holistic and even across the spectrum of teeth, and not significant in any given area. So these are things to watch out for. And if you are getting creative with your products because you think that you might be sensitive to something, if you're getting those measurements, you're going to have a real-time evaluation of improvement. So that's one way
Awesome.
to track,
Yeah.
and also give your provider a feel good when you've gone off the rails of your fluoride over the counter, opted for fluoride varnish, and are getting, more natural toothpaste that might not look like a good idea to them. But if you have those probing measurements to fall back on to show them that they're maybe, need to think outside the box, it's
Right.
helpful for all of us.
Yes. Okay. Tell people where they can find you and your products.
So I talk my geek life at Oral Health Activist. That's my Instagram handle. And then osacare.com is my product line that I hope to be solving the inflammation story, but also preserving inflammation holistically so that we don't age as rapidly. And so we have this nice, soft aging landscape
I love that.
that we see in a
Gracefully,
healthy
right?
person. Yes,
Yes.
exactly. Yes.
Well, Camille, thank you so much for coming on today. This has been really fascinating. I appreciate you entertaining all my questions and answering them to the best of your ability. And I would say, like, very objectively, too. Like, so I love that. So everybody, I would definitely check out her website, check out her products, osacare.com. And at OSA Care at Instagram.
That's
So
great.
thank you, thank you. And if there are any follow-up questions from you guys out there, please submit them, and maybe we could do a follow-up episode because
That would be super fun.
I'm sure there's more that we didn't dive into today. So,
Yeah, no, we could go neutrophil systemic health all day with me.
oh
So
yeah. Awesome.
next time.
Okay. Well, again, thank you, Camille, and thank you everybody for tuning in today. Make sure you check out drlaramay.com for the show notes. That's where the links live. So if you are in a place where you can't write down the information and you want to refer back to the links, they live at drlaramay.com/podcasts. So thank you, and we'll catch you on the next episode.